All right, well, now we have Nurse Jackie coming on. Good morning, Jacqueline, I see your name is. Good morning, Jacqueline.
How are you, Polly? I'm good, thank you.
Now, tell everybody what kind of a nurse you are.
I've done a little bit of lots of different, but I'm mostly just a bedside nurse. So your standard medical floor, that's where you'd find me.
Okay, not just about these bedside nurses, call yourself incredibly important, especially good ones like you. And you have 4 unvaccinated children.
hmm Yes, we have 4 daughters. They are 6, 3.5, 1.5, and 4 months. Right here, you can see with me. And they have not had anything at all. COVID vaccine, regular standard childhood vaccines, none of it.
What about vitamin K?
Let's see. 2 of them did have vitamin K. My first 2, all of them have been cesareans. So, um, my first 2, I wasn't as educated on that, but the other ones I did waive. My last 2.
So here's the big question. What made you, as a nurse, someone who's gone through medical training, what made you decide not to vaccinate your children?
There is a lot that goes on inside of the medical system that does not necessarily follow evidence-based practice. And to me, vaccines are one of them, especially working through COVID. There were a lot of things that just really started coming out that things just were not safe. And my mom had a big influence on me. She stopped vaccinating us after my, let's see, I'm the oldest, so the third brother. There are 8 of us total, so the last 4 or 5 children have not had any vaccines. And so she really influenced me to do my own research. And then once I did, and then once COVID hit after that, it really just cemented that this is not something I want to be injecting my children with at all.
Okay, so that's really interesting. Just to wind back to your
Sure.
siblings. So 4 of them have had no vaccines, and how old are
Yeah.
they?
Let's see, that would be starting, how old am I? About 21 years old and down to 7 years old.
And how are they, those 4 unvaccinated children?
Well, actually, all of us are in near perfect health. The younger ones, especially, they don't have, this all the standard childhood problems, ear infections, respiratory infections, eczema, all those things that you see in children at a high rate, just kind of in general. We don't really have those problems in our family.
And your children, your 4 children, how are they? Do they get sick? I mean, we no one's saying kids don't get sick.
Well, I mean, yeah, anybody can catch the common cold, but between the 4 of them, so, and remember, this is with my husband and I both working at separate hospitals, being exposed to all kinds of, viruses and infectious diseases. Oh, yeah, there's a picture of us together when I went and saw him one day. We have never had a child hospitalized. We've never had an ear infection. We've never had RSV, never had any type of like developmental delay diagnosed or, uh, neurobiological problems. So I feel very thankful. I do feel that choosing not to vaccinate has played a huge part in that because our children are healthy, they're normal, and they are, I think, as God designed them to be.
And your husband's medical as well then?
Yeah, he's a nurse as well, and right now he's working in the ER.
And he was on board with this?
Yeah, thankfully. I've had a lot of strange ideas. He was raised in Southern California, so very, very different upbringing. Him and his siblings did not grow up in a home where, vaccination was something that was talked about. They just kind of did all the normal things. And so I'm very thankful that when he married me, he was willing to give me some wiggle room to make choices that I felt were better for our children.
And how does he feel about your beautiful, healthy children now? Does he feel you've made the right decision?
I think so. And there's been a couple of times where some of his coworkers have kind of made comments like, "Oh, you don't vaccinate your children," or, how has that turned out? And I, I think that we are very thankful because everybody we know that has vaccinated children, there's asthma, there's developmental delays, autism. And I think that he's very thankful that we made the choice to just keep our children from being exposed to all of the aluminum and adjuvants that are really damaging other children.
Now, are you afraid of measles, mumps, rubella, I don't know, all of those kind of things?
I'm really not, because you take tetanus, for example, and they want to stab you with a tetanus vaccine anytime you walk barefoot outside. But the treatment for that is so simple, and the survivability is so high. Even with COVID, children who caught COVID, the deaths were so low and the major illness was so low. My stance has always been that, if I'm going to trust the Lord in every other part of my life, I'm going to trust him with the health of my children. And with these childhood illnesses that everybody wants to be so scared of, actually have a very high rate of survivability. And I would rather take my chance on an actual real live infection than on an injection that I don't know what the repercussions of that are going to be.
Jacqueline, you were a nurse during COVID.
Yes.
So tell us what that was like, because you were outspoken about the COVID shot, weren't you?
Yes. And there was a lot of fear in the beginning. There was so much that was unknown, and you couldn't go more than about 2 seconds without somebody either commenting on the effectiveness of the vaccine and how great it was that we were going to have this vaccine. But then you had people getting vaccine injured before that was acceptable to talk about. And I saw several of my peers rush out to get the vaccine, several nursing friends, and then suffer debilitating reactions. And, already being vaccine injury aware from choosing not to follow the childhood schedule, as soon as the COVID, quote vaccine, because it's not actually a vaccine, it's a totally different product than what most people think it is. I kind of saw that was a fraud right away. And I was especially hesitant because I was pregnant at the time. And Paula, you'll love this. So I was working on a psychiatric floor, and a psychiatrist, not even an immunologist or, somebody who works in infectious disease, we were going over in a board meeting, and I had stated that I wasn't getting the vaccine and I was pursuing an exemption because I was pregnant. He's like, "Oh, well, I can give you the research that states it's safe and effective." And I was like, this vaccine has been out for all of 2 months. This was 2 months after it had been released to the public. And I wanted to ask him, where are you getting these documents, these supposed documents? And so there was so many conversations like that early on that people thought you were a lunatic. Here I was wearing PPE, mask, respirator, doing all the things, taking care of patients on the bedside. And they thought I was literally insane for not getting this injection that was supposed to protect me. And now here we are years later, and I am still very, very thankful for that choice. And fortunately, again, my husband was willing to go along with me on that and chose not to receive the vaccine as well, even though he was also working, bedside nursing at that time also.
It's incredible, Jacqueline, isn't it? I mean, we were brought up to, respect people in authority, if you like.
Mhm.
If you're a doctor, you're apparently super smart. But
Yeah.
now, through COVID and stuff, it's really extraordinary when you hear non-stop stories like you just told about the almost stupidity of these people.
Yes. Yes.
And your husband working in ER makes me feel, because he's obviously a good man, so it makes me feel good but most of our viewers, I would say, do not want to go to hospital because we've seen what happened during COVID, that the vaccinated versus unvaccinated were separated, treated differently, potentially killed. And there's a beautiful unvaccinated child in the background.
Mhm.
So what do you say about the hospitals? Do you think they're dangerous places to go?
I think that if you absolutely need to go to a hospital, you should go in with your eyes open, and you should not take everything that you're told at face value. You should get second opinions. You should, really actually read the informed consent papers that they give you, because there are so many. Even just when I give medicines in the morning, when I hand out morning med pass, that cup full of pills that people take every day without question, without anything, there are so many hidden dangers within that. So if you're going to be in the hospital, don't assume everybody's out to get you. Obviously, we're not malicious, especially people like me who are just trying to serve our patients as well we can within the system. But definitely keep your eyes open and keep your wits about you.
A great advice. And Jacqueline, what's your advice to the young mum who's just reading the wrong media, if you like, watching the wrong media, and is petrified of the disease, so therefore is going to vaccinate, but in her gut feels that vaccinating's wrong, but doesn't know what to do?
Oh goodness, my heart goes out to her, because there are so many things that I have been that young mom on. But you need to do research, and you don't need to just Google it, because if you pop, anything on vaccinations into a standard search engine, you're not going to get anything. So my hope for that young mom would be that she could find Children's Health Defense or a similar organization and actually get truthful, unfiltered information that is safety based. It's not fear mongering. It's not trying to push an agenda. We're not following the dollars, but we're following the actual research. So that is my hope for that mom, is that she would just be able to step back and think and follow the patterns and look at the children around her and say, is this how I want my children to be? And if it is, then yeah, I'll go to a pediatrician. I'll follow the standard childhood schedule. I'll let them, eat red dye 40. But if not, if that's not how she wants her children, if she doesn't want asthma and autism and all the other things, then she may want to make different choices.
Yeah, I don't know why anyone would go any other way than your way, Jacqueline. You're an amazing family, and I appreciate you so much for coming on. It's such a brave thing to do in this day and age. So thank you. And to your beautiful children as well. You've got a great future.
Yeah. Thank you so much for your time, Polly. I appreciate it.